Yes, we can hear you, Dr. Vohra.
All right, great. Thank you. I'm going to be just sharing content verbally today because I've got internet issues. And as you can see, I've been banished to my child's kingdom. So I'm going to be just sharing some notes. However, my PowerPoint is ready to go. And as soon as my internet comes back up, I will be able to share our notes today for you. So with that, we'll go ahead and get started. It should be a pretty short agenda on this hot Friday afternoon for you. I hope that you're staying safe and cool. We'll talk about COVID. We'll talk about monkeypox, or mpox, as the cool kids like to call it, flu, heat, and webinars that are coming up that you news is that it's still circulating. However, we have good news in that we are now ready and able to provide the new bivalent boosters here in Fresno County. So you should be able to work with your favorite pharmacist or doctor or one of our free vaccine clinics that are partnering with us to be able to provide those vaccine boosters, which are now bivalent. And these are indicated regardless of how many boosters people have had in the past for anyone over age 12. The recommendations for people under age 12 have not changed. And so you can go ahead and get the boosters today if you can get signed up on the MyTurn app or work with your provider to get that booster done. We know that a lot of our hospitals are going to provide these for their staff, which is wonderful. Please work with your teams to see how you can keep your staff protected. We still continue to hear about many COVID infections. And so this is a really good strategy to really put us in good shape for the fall when we know that, COVID may come back around. So I'll include things in the slide set about the boosters and the summary of the booster recommendations with links about how to sort all this out. As you know, depending on the age group, there's different recommendations. These bivalent boosters, which contain an alpha antigen, as well as an Omicron antigen, that's why they're called bivalent, and they really provide protection against this spectrum of different variants of kids that are 5 through 11 and kids that are 6 months to for Moderna or Pfizer, and they will need to get their primary shots as well as monovalent boosters if that's indicated, depending on which product they're using. Moderna, which is just primary shots, and Pfizer, which also has a booster for the 5 through 11 age group. I have a really nice graphic from the CDC that I'll share in the notes. Any questions about that? All right. Well, we are on the cusp of influenza season, and on September 2nd, we actually signed the flu order for healthcare providers for Fresno County. The flu order looks just like it did last year. Went to my authority and the authority of the health department. We are ordering licensed acute care hospitals, ambulatory and community clinics, emergency medicine service agencies, long-term care and skilled nursing facilities, mental health and SUD clinics, and private physicians' offices in the county to implement a program requiring healthcare personnel to receive an annual flu vaccination. The fine print is provided in that letter. Please let us know if you did not receive it. Hopefully Sim can share it in the chat. The badge color this year is brown. We know that some organizations like to use these badges as signifiers of who has been vaccinated and who has not been vaccinated. It becomes less of an important point because of universal masking. So if you still want to do a badge system, just to give your staff a pat on the back, to really reward those who have gotten their vaccines, then basically feel free to do that. The badge color that we're recommending this year is brown. So everyone at a healthcare facility who's been vaccinated wears a brown badge to designate that they've been vaccinated. If you're not able to do it, if it's not feasible for you, don't lose sleep over it. We already put that in the language of the letter that you only need to do that. It's not mandatory to have that badge. It is mandatory to have your folks vaccinated. Heat waves will continue to occur. And so I have some language about heat waves. Sorry, I'm skipping ahead of myself. Let me go back and talk about monkeypox before we get into heat. So with monkeypox, also known as Mpox, we actually have been given about 800 doses of the Jynneos vaccine product, and we have gone through about 500 doses, which is fantastic. We've been able to protect 500 people in our county, but we still have that 300 vaccine doses left for administration, approximately. And so we really need to get through those before the state gives us any more. So we know that these supplies are short, and we're afraid that we will not stay caught up with who needs to be vaccinated unless we get these supplies out. So we're please asking all of our providers, but especially those that are already vaccinating, to ask for more doses and to really get these doses into patients. We've also changed our eligibility criteria. So I'm going to run through the list of eligibility criteria, and I'm going to highlight what the new eligibility criteria are. So the eligibility criteria are, as of now, those who have been identified as a close contact of someone who already has the infection, whether it's suspected or laboratory confirmed. Those who are laboratory workers or frontline clinicians or public health response team members that handle the virus because they're swabbing people in their line of work or doing the testing in their line of work, or simply just want to have that extra level and they really would sleep better if they had this. Then we basically feel comfortable that we have enough supply to where we want to support those who are at occupational risk from the Mpox virus to be able to have that protection. Those who are attending events or venues where we know exposure has occurred within the last 14 days, these might be parties, these might be bathhouses and some of the massage parlors. These might be different events that are going on all around the country, not even in Fresno County, that are attracting people that may have the monkeypox, who are then having intimate contact, skin-to-skin contact, sexual contact, and then allowing it to kind of spread all over the country. I'm not making this up. Our patients are actually describing these events that they've attended where they've actually most likely picked up the infection. So we know that that's a high risk encounter, and we want people that attend those to, not feel any stigma, but to be protected if they are attending those sorts of activities. The new criteria that we've now put in really has to do with the fact that it's not just MSMs. It's not just men who have sex with men. It's really people that are having other kinds of risk that we want to protect. So that includes individuals of any sexual orientation or gender identity who engage in high-risk sexual activities. The new HIV infection in the last 12 months, those whose doctors have put them on HIV pre-exposure prophylaxis, those who are diagnosed with other STDs like gonorrhea, chlamydia, syphilis in the last 12 months, and those who are sexual workers or sex workers, we know that all of these folks are at increased risk of having the Mpox infection and then passing it on to their families and the community. And so we want them to be protected by having this access to this vaccine. So those are the new criteria: is individuals of any sexual orientation or gender identity with high-risk sexual activities. And then the last new couple who got their MPX vaccine 28 days ago, they now need to go back and get their second dose. Because remember, this is a 2-dose deal. They're not fully protected until they've had 2 doses. And so people that have been vaccinated 28 days or longer ago need to come back and get their second dose. We're now encouraging those folks to get in and get their second dose. All of this is summarized in a very nice flyer that our PHC team has put together. So please look for that in your chat or in your email later this afternoon. We've also got a nice flyer about close contacts. So as you know, contact tracing is something that we do for all infections. Sometimes public health does it. Sometimes you do it. Sometimes the patient does it, and whether it's lice or gonorrhea or anything in between, you really have to do contact tracing in order to really figure out how to contain whatever infection or infestation you're talking about. With close contact tracing of monkeypox, we have a pretty good idea of who's at high risk. And we've really summarized that in a nice flyer that really summarizes who are the close contacts and what should people do once they identify who those close contacts are about notification. This is a flyer that you can just hand to your patient and their families to really help streamline that conversation that you might be having. There's a lot of anxiety out there. We know you're fielding a lot of questions. I field questions and text messages every day about who may or may not have Mpox. And so having a flyer like this will actually help you have really high level conversations and then be able to hand somebody something that they can go home and read on their own time and really get their answers about whether they're at high risk, and if they are at high risk or if they do have the infection, how to protect their loved ones. Any questions about that? Treatment is still available with the TPOXX. The TPOXX is the antiviral. It works really well. I mean, it really clears up the rash. It takes away people's pain. It allows them to get back to normal activities a lot sooner than if they otherwise would. So just remember that our TPOXX program is very valiantly spearheaded by the UCSF Fresno ID team. And so you can contact those individuals. If you need help figuring out where that information lives, please reach out to us. We have a really nice packet that we've put out before. It's still relevant, and it basically gives you all of the criteria for who needs to have TPOXX. It's really anyone with immune compromise or severe infection or infection around anatomically sensitive sites, including the eyes, the mouth, the genital urinary regions that would basically preclude them from having a normal activity or normal activities of daily living. And so those are the folks that really need to have TPOXX. Weekend, who's hospitalized. He has a poorly treated HIV disease on top of the monkeypox infection that he has all over his body. He needed to get TPOXX, but he also needed to be hospitalized just because he was so sick. So these folks are out there, and we know that they're suffering. We don't want them to suffer unnecessarily. And so that's why this TPOXX is such a great medication to know about. We know Kaiser, our partners at Kaiser are also offering this medication. So either the UCSF Fresno ID team or the Kaiser team can help guide you to if your patients need TPOXX or if you have more questions about how that process works. And for now, we're still continuing on that same program. We have all the phone numbers, we have all the indications, the inclusion and exclusion criteria for that medication in the packet. So please look for that information there. And finally, we'll talk about heat waves. So the heat wave is still continuing, and it's longer and more intense than just about any other heat wave this year. This is really a sign of the new normal, in my opinion. These are going to continue to come every summer here in the Central Valley. And so the sooner we can prepare and protect our population, the better our health outcomes will be in Fresno County. So I really feel a real urge to, message about this and to really help educate about this issue. We know that the children, the elderly, and those that are disadvantaged, impoverished, living on the margins are the ones that are going to suffer the most, whether it's dehydration, heat stroke, cardiovascular illnesses, or respiratory illness exacerbations. All of those are being seen in our local emergency departments. I worked a shift in the ED earlier this week, and really the ED is being used as a cooling center. People are coming in just to get good air conditioning. After a couple of hours, they feel fine. They don't really know, they can't pinpoint any specific symptom that brought them into the ER. We have to do a big lab workup in some of them because they have underlying medical conditions. And you know what? Nothing turns up. So that's how insidious heat illness can be. The time they feel sick, they just know that they have to get out of their environment. And if they have the wherewithal and resources to call 911 or to get themselves transmitted, if they're not able to get to a cooler spot and they themselves can't thermoregulate because of their underlying medical illness or because of medications that they might be on, then those are the folks that are in real trouble. Included in the slide set. But really, whenever the heat index is above 90, we know outdoor workers are more susceptible. Whenever it's above 100, we know children, elderly adults, and pregnant women and people with cardiovascular disease are at heightened risk of heat illness. And we know when the heat index goes above 105, really everyone is susceptible. And we're even asking athletes in the schools and colleges to sit out whenever it's greater than 105, because any intense period of exertion, even a few minutes, can really make people syncopize or have heat cramps and heat exhaustion, or even go on to have heat stroke, depending on how intense and how long the duration of heat exposure is. And unfortunately, 105 is just where the charts end. We know that the heat goes much higher than that. I clocked 111 just driving around yesterday. So we know that people that are homeless, people that are not able to air condition, people that are outdoor workers are all suffering in this heat wave. And we really need to protect them and let them know that they're seen, they're heard, and that we need to help provide resources from them. Remember, medications can affect thermoregulation, and that includes all psychotropic medications, such as our antipsychotics, antidepressants. A lot of anti-Parkinson meds create anticholinergic symptoms, which prevents people from sweating effectively. People may be on prescription amphetamines or be taking recreational amphetamines. People on beta blockers or lithium, or people on other serotonergic agents. These are all medications that affect, you may not be a toxicologist, you may not be as educated about all of these drug-drug interactions. You can always call poison control. You can always contact a pharmacy to see what medications people are on. Just remember to keep that in the back of your mind, that even if the person is otherwise healthy, the medications that they're on may actually be a real handicap for their ability to thermoregulate during heat waves, and take that into account whenever you're seeing them in your encounter. The state of California is actually making a lot of materials made available. I wish it was more than materials. I wish it was actually, resources and policies and laws, but right now it's just at the level of materials. And so that's what we're dealing with. But anyway, the materials that they're putting out are basically education about how to keep priority populations safe. People without electricity, whether that's because they can't afford electricity even on a good day, people that are just losing electricity during rolling blackouts or flex alerts. Those are all people that we worry about, especially those that are dependent on medical equipment or even refrigeration, like their insulin has to be kept refrigerated. Obviously, people that are unhoused, people that are in single room occupancy hotels, people that are living in geographic areas where homes have historically not needed or don't have air conditioning. Like up at altitude, for example, we know that a lot of those homes, just like on the coast, may not have air conditioning. And during heat waves, those are the places that really get super hot, and people are not prepared because there's just no air conditioning that's wired into those structures. Homebound individuals that can't move around easily, pregnant individuals, people that don't speak English and don't have access to the same informational resources and media that the rest of us do, people that are struggling with substance use disorder, whether that's opioids or alcohol or amphetamines, mental health illness patients, infants and young children, and the elderly are all priority populations. We're seeing these folks every day. Whether we have this conversation with them, whether we do a deep dive into what are their needs around the heat wave or not, they're suffering out there. And we need to at least be aware that we have much work to do in our medical community for making our population more resilient. Whenever I share out these notes, I'm going to share out some links that I hope that you have take time to read. And these are basically just state and local programs that help people with environmental resiliency. Remember that occupational workers are protected by the law. The employer has to provide water, shade, and rest, and really protect against high heat injuries. And so just keep that in mind, that if agricultural workers are reporting to you, then really it's on you. It's a duty and responsibility that you have to report that to either the health department or the agricultural commissioner, that the law is not being followed. Just remember, a lot of people are coming up with a lot of tools. I think we're going to see a lot of good action. I hope constructive action. We're taking some here locally with our Fuerte project and our C6 collaboration. The health department is trying to help as best as we can with the limited resources that we have, but we really are trying to reach out to the vulnerable communities and asking them, what do you need? What are your challenges? Are the resources that are being provided a match for what you actually need? And what can the government, the local government and the state government do better in order to help you be more resilient during these times of environmental stress, whether that's heat or air pollution or drought or any number of other hazards that we know are happening and intensifying in this era of climate change. You might have gotten a text message earlier today about flex alerts. So flex alerts are a way to help save the electric grid. And all of us can be doing more by setting our thermostats to 78 degrees or higher, avoiding using major appliances like laundry, turning off all unnecessary lights, using fans instead of the air conditioner for cooling, and unplugging any unused items. So those are all really easy things that all of us can do, especially those of us that are in a place of privilege, that we can all be doing to just save electricity on the grid. And hopefully all of us can take time to make these very small changes, teach our families and our staff to make these small changes. And just, even though it's a little bit more inconvenient and a little bit more uncomfortable for us, it really does a world of good when everyone takes the time to make these small changes to make sure that the grid stays active, to really keep the lights on in so many ways. There was actually a hospital in Santa Clara County that lost power, including their ICUs earlier this week. And I've seen hospitals lose power as a result of hurricanes when I lived in Houston, Texas. So this happens. Mother Nature is a very formidable foe whenever we're not on the side of prevention and preparedness. And so whether it's hurricanes or heat waves, the electric grid is quite fragile and we take it for granted, and our hospitals depend on it. So I think we all deserve to know more about how we can make it more resilient, and the steps that we can take to all of us contribute to the solution instead of the problem. I will close with several webinars and CMEs that you should probably catch. Remember, all of these are recorded. The first couple are COCA calls. So COCA is a CDC program, and the COCA calls this week are covering influenza vaccinations. That was actually done yesterday, but the recording is available, and I'll send you the link. And then the one next week on September 13th is about the bivalent boosters, which I talked about for COVID, and what to know about those and what those recommendations look like. And you know, people ask really great questions about what are the exceptions, what are some of the nuances. So it's really worth your time to spend an hour just learning about that, especially if you're a vaccinating provider. There's also a great program coming up on the 17th of September from the UCSF Fresno program. It's about air quality and climate change right here in the Central Valley. So speaking of heat and climate change, our wonderful associates at UCSF Fresno's pulmonary department have put together a whole day-long symposium that looks at air quality and climate change and the health effects that are going to be affecting our populations here in Fresno County. So I urge you to catch that, and we'll share a link to that as well whenever we share out these notes. All right, those are all of the notes that I had for this call. Let me look on the chat and just see what people are talking about in the chat and see if there's any questions that we need to address. So Sim, as always, has done wonderful with putting in a lot of links in the chat. Hopefully you can catch that. Sorry, I know I'm breaking up. It's just because we're having work done here and I don't have good internet right now. Chris says, please donate type O blood today and tomorrow. There's a very low supply of type O blood. They also need platelets. In spite of the high heat, blood donations have been good in recent weeks. Thank you to the supportive communities. So that's good to hear, Chris. Thank you for sharing that. And Sim has also shared the schedule of COCA calls from the CDC. And I'm happy to take any questions. Sorry about the technical difficulties today.
Hey, Dr. Vohra. Hi, this is Chris. Thank you for the presentation. How are you doing?
Good. How are you?
Good. Good. Hey, listen, if folks have had Omicron already,
yes.
Like let's say May of this year,
yes.
It's still recommended to get the new shot, right?
I would. You know, you're probably, honestly, you're in all honesty, probably pretty good protected going into the fall. But why risk it? You know, I mean, anything could happen. We could come up with a hyper contagious version of Omicron that really evades prior immunity there could be a new non-Omicron variant that raises its head. So the more you train your immune system, the more cross-trained your immune system is, the more mild your future infections will be. I think that's the logic that's really persisted throughout the pandemic. And so whether that's from surviving a real infection from COVID or getting whatever vaccine is available at the time, I really think that it's wise to cross-train your immune system. And we know these vaccines are safe and effective in the populations that have been tested. Whenever it comes to the Omicron and the post-Omicron infected population, I haven't seen any official studies on that, but I get the feeling that even those folks will get some benefit if they get their vaccines after an Omicron infection. I'm in the same boat you are. I had my Omicron illness, and really my whole family had it in January. And so it's been quite a while for me. So I'm actually quite ready to get this booster. However, many other people have had Omicron more recently, and so they're actually even more protected than I am. But nonetheless, we should all be thinking about getting our booster pretty soon here.
Okay, thank you.
Sure. That actually touches on another question that's very common, which is how long do you have to wait after an infection? And technically, the day that you are asymptomatic, you can go ahead and get another vaccine. But if you want to wait a few months, that's okay too. Spacing it out is probably wise as well, because you want to give your immune system time to recharge and get strong again, and then it'll actually push that memory out even longer. So you want to just space it as far as and wide as you can, but without risking, catching another infection in the time. So that's more of an art than a science. And the explanation is, just it depends on your own individual risk. If you're otherwise healthy and you feel comfortable and you can accept the risk of waiting a longer time, that a little bit longer after an infection. People are asking, Naomi's asking, is this new bivalent just a one-time, or does everyone need 2 boosters? Right now, they're saying this one booster is the one you need for this fall. And after that, you're probably going to need a booster every fall, just like we do with influenza. I think that's what the White House has said. I'm imagining maybe this is a little aspirational and idealistic, but I'm imagining that they base that statement on some kind of science that someone has done. But they're saying that annual boosters for COVID is going to be the new expectation and recommendation. Just like we have annual boosters for flu, we don't call them flu boosters, we call them flu shots. So it's going to be the same thing. It's basically every fall, which is when we know we have surges of COVID. All right. Well, if no other questions in the chat and no other announcements, I think we'll adjourn and let everybody go back to their weekend planning. Hopefully you can stay safe and cool. This heat wave will end, knock on wood. We'll have much work to do when it does to prepare for the next one and all of the other climate challenges to come. But I hope that we can all dedicate and commit ourselves to being partners for that challenge, just like we've been for COVID and monkeypox and everything else. And I think that together we can achieve great things. So I look forward to continuing this partnership with all of you. Thank you for spending some time with us. Look for these notes later this afternoon. I will send them out over email, and have a wonderful weekend. Take care.
Thank you.
Thank you.
Thanks, bye.
Bye.